Hi, welcome to my presentation on Zika virus's burden on women, looking at the United States and India, and this is a photo of India. I'm going to go ahead and share my presentation with you. All right, so the scope of the work was taking a look at the historical data about Zika virus to understand its origin, spread, and evolution, how the United States and India mitigated their spread, and looking at how women carry the burden of the virus, specifically in these two countries. So just a brief overview of the virus. So the primary vector is called Aedes aegypti, although other vectors exist. And so it's passed via blood meal. So we've got the mosquito that is sitting on us, drinking our blood. And so that's how it's passing back and forth. The incubation period is 3 to 12 days, with 4 out of every 5 persons are actually asymptomatic. Those that present symptoms might have a low-grade fever, headache, conjunctivitis, joint pain and stiffness, edema, muscle pain, and skin rash. And GBS is actually something that's been showing up with Zika virus. There's unfortunately no cure, there's no vaccine, and there's no treatment outside of pain management and antihistamines. So it branched into 2 different lineages. So you have the Aedes africanus mosquito from Africa and the Aedes aegypti mosquitoes from Asia. And then the Aedes aegypti continued to further divide into new sublineages upon arriving in the Americas. It's also possible that other mosquitoes native to tropical cities may be vectors, and also mosquitoes that live in more cold hardy areas as well. And so what we see is that these 2 different types of mosquitoes may have had a sylvatic cycle and or transmitted from mammals, such as domestic animals and rodents. The mammals contracting Aedes aegypti may lead to this probability of zoonotic transmission. And so this possibility that we might have these continuous outbreaks as long as infected mammals live next to humans. So we talked about this blood meal, right? The mosquito is biting us as a method of receiving the virus, but there's also sexual transmission that was found during a pandemic in yak. So the African lineage has shown the potential for sexual transmission, as has, of course, the Asian lineage. Semen samples indicate the virus can be passed through sexual transmission, and vaginal secretions are showing positive up to 14 days after possible exposure. It can also be passed via saliva, urine, and amniotic fluids. And so the Zika virus has also been found now to cross the placenta, infecting the fetus of pregnant women. So the Aedes africanus, the mosquito from Africa lineage, has higher mortality rates and more severe illness when compared in mice models to the Asian lineage. But the Asian lineage, the Aedes aegypti, is presenting this GBS as seen in French Polynesia during their outbreak. Brazil started to show the presence of birth defects. And of course, one of the strains from the Asian lineage has adopted to cause more severe damage to the nervous system, as we see in GBS. So the evolutionary context with climate change is that right now it's difficult to have year-round transmission of this in the United States, and particularly northern India, when it comes to the Indian subcontinent there. In the United States, homes and buildings are equipped with windows and doors, which are great for mitigation. But we do need to review cold hardy mosquitoes to see if they're possible vectors. In India, the climate permits in general for Zika to spread rapidly. Monsoon season is a very potent time of year, particularly towards the end in August, placing 1 to 2 billion people at risk. And India is considered one of the most hospitable places on the planet for Zika virus mosquitoes to live and to breed. And so with its large population and poverty levels in India, it can make the likelihood of community spread very high during outbreaks. So with climate change, we're going to start to see the range for these mosquitoes increasing. We're going to see changes in the life cycle of mosquitoes. As we see land changes, both of these are going to equate to outbreaks in areas that may not traditionally have seen areas with Zika virus before. Higher temperatures are going to create more moisture in the air, which means that there's going to be more rainfall in areas with, particularly with monsoon seasons, and create even more ideal breeding grounds for mosquitoes. But areas with drought are not exempt because female mosquitoes have been found to have higher bite rates in areas with drought, and also they increase their range. So both the United States and India, in terms of global health disparities, both have social stratification. So India has their caste system, the United States has socioeconomic, race and ethnicity, gender, and sex stratification issues. And there's also changing climate due to climate change. Healthcare is managed on state levels in both countries, which can create conflict and disease mitigation. And additional burdens on women are exacerbated by these social stratifications. India has universal healthcare, but it's run by states. In states that have lower incomes, the healthcare quality is not so wonderful, which leads people who have the means and ability to go into private healthcare for their health. But that leaves an entire population without quality healthcare. Studies have shown that men 2-to-1 use hospitals more than women in India, which starts to show that there is an issue with women accessing healthcare in hospitals. In the United States, it's privately funded healthcare, although there is some government assistance, which women use government assistance more than men in the United States. Women are also bound to use their spouse's health insurance more than men do. The United States, unfortunately, has the highest maternal mortality rate of any other developed country. In the United States, between 2016 to 2017, there was an outbreak which led to 231 people contracting it from visiting Florida and Texas. 5,389 people became infected after traveling to countries experiencing an outbreak or sexual transmission from someone who did visit one of those countries. In 2016, pregnant women accounted for 1,300 positive cases, and of that, 1 in 10 had a baby with birth defects. There was the ability to test for Zika antibodies, but the technology was still new, and so there was a lot of false results. Local municipalities and states began to be responsible for testing, reporting, and outbreak management. And so there was this variance where in 2017, in some states, only symptomatic individuals who may have had exposure to Zika virus were tested, where then other states, only a few of them, were testing pregnant women regardless of potential exposure. In India, the federal government had established trained laboratories across several states to test for Zika virus, and yet it did not use these tools effectively to predict outbreaks. And so in 2018, Rajasthan had 159 reported cases, and Madhya Pradesh had 127. So it's believed that because of the sheer population, that it was actually undercounted. Weekly surveillance of the Asian lineage shows that they did not carry the mutations S139N and A188V, which were known to cause fetal defects in the Americas. But it was believed that it's not prudent to not believe that women in India could have birth defects with their fetuses. The Ministry of Health and Family Welfare, they were unable to use their resources created to track and address, though unfortunately, microcephaly when it did actually occur in pregnant women infected with Zika. And so, but India did do a Zika surveillance of pregnant women, regardless of whether they were symptomatic or asymptomatic, which was dramatically different than the United States, which was good because in Madhya Pradesh, 43% of women were pregnant, and the men and the women who were positive had not traveled to areas with with outbreaks. So in the United States, the White House in 2016 had a plan of action. It was going to be focused at readiness on the state and federal level, included funding for surveillance, vaccine development, education of vulnerable populations, and other mitigation efforts. But unfortunately, the US government downplayed the outbreak by focusing on travel advisories, recommending that Americans do not travel to countries with outbreaks and that pregnant women avoid infected areas. The CDC doubled down and then also introduced language to pregnant women only when that women should be concerned only when traveling to and returning from these outbreak areas. Florida had their own objectives, such as supporting pregnant women who were already identified as having Zika virus, considering them a compromised population, and also communicating with all Floridians about making their best choices on travel and local risks. Health departments, unfortunately, across the country faced obstacles communicating to the public due to lack of trust in the federal government, language barriers, and then those outbreak areas of Texas and Florida, due to their population of undocumented immigrants, were having a difficult time communicating because of the fear of safety undocumented immigrants had. And of course, economics played a part in this because in low-income neighborhoods, they needed to have their windows open to circulate air. So 31% of women did not know that Zika virus could be contracted by visiting countries with outbreaks. This is now in the United States. So another 42% that were polled did not know that Zika virus was sexually transmitted. Almost a quarter polled did not know about the correlation of Zika virus with microcephaly, showing that these large gaps of information that were happening in the country. Pregnant women in Texas, which was an area of concern, also did not know that Zika virus could be transmitted sexually and could lead to birth defects. Regardless of the socioeconomic and or race, ethnicity, women in the United States found themselves with another obstacle, another stigma, and indicated if that they were found to be infected while pregnant, that they would actually keep their diagnosis a secret. In India, during a 2017 outbreak in Gujarat, the national government delayed relaying information to the World Health Organization. They did not communicate to the public via the press. They withheld information from their National Integrated Disease Surveillance Program. They were also testing patients for mosquito-borne diseases without their knowledge and consent, and they weren't communicating to the local governments about their surveillance. And they have public fact sheets as well for the public about Zika virus, but they do not include any information for women in terms of conception, contraception, or pregnancy to educate women about the potential of sexually transmitted Zika virus and its effects on their fetus. So in terms of the pregnancy and fetus, a 2019 study showed that regardless of the trimester, women were shown to be affected by the virus. Fetuses presented issues such as a limited motion of joints, in arms and legs, and as well as what we talked about, which is the microcephaly. A high percentage of asymptomatic cases, preventative measures to prevent fetal complications have become an additional burden to women, adding to a complicated socioeconomic and also legal obstacles that women face in countries where Zika virus is high. So United States and India either have or have been advised to begin to use faith-based organizations and community groups to help disseminate information to the public about Zika virus. But the stigma that women experience in terms of their own sexuality, their ability to make choices in regards to their body and their fetus is present in both countries. And these groups may not be able to navigate these cultural norms. And while women in India can terminate their pregnancy up to 24 weeks, you'll see in a moment that that actually is still not enough. The United States, unfortunately, had a repeal of Roe v. Wade this year, which resulted in bans in 14 states. Some are full bans, some are 6-week bans, and there's more states that are ripening to follow suit. So microcephaly is generally diagnosed in fetuses, but not until the 28-week mark. So that is still beyond any capacity for women to terminate a pregnancy if she found out in India, and of course could be a nil conversation for women in the United States. continuing to leave women once again in a vulnerable place without government support. So thank you so much for joining my presentation on Zika virus's burden on women, and I look forward to your questions.